Welcome back to the Relationship Institute, where we dive deep into the complexities of human relationships. I'm your host, Alex. Today, we're taking a closer look at a topic that has gained a lot of traction in recent years, narcissism. But we won't just skim the surface, we're going to unpack it thoroughly. To help us navigate this often misunderstood subject is our expert guest from the field of mental health. Welcome.
Thank you, Alex. I'm excited to be here and discuss what I believe is a crucial topic for understanding our interpersonal dynamics today.
Absolutely. Let's start with a fundamental question. Many people think of narcissism simply as self-centeredness. How would you define narcissism, and how does it differ from a clinical diagnosis known as narcissistic personality disorder?
That's a great place to start. Narcissism, in everyday terms, refers to a collection of traits or behaviors that revolve around an inflated sense of self-importance and a lack of empathy. It's more about patterns of behavior rather than a specific disorder. Narcissistic personality disorder, however, is a clinical diagnosis. It's included in the Diagnostic and Statistical Manual of Mental Disorders, and it's estimated that between 1 to 3% of people actually have this disorder. The tricky part is that many individuals with the disorder don't seek treatment because they often don't see anything wrong with themselves.
Interesting insight. So when people throw around the term narcissist, they might not be referring to someone with a personality disorder, but rather someone who displays narcissistic traits. What are some common behaviors or patterns associated with narcissism?
Exactly right. Common behaviors can include an excessive need for admiration, a strong sense of entitlement, and a lack of real concern for others' feelings. You might find them dominating conversations, needing to be the center of attention, or even belittling others to make themselves feel superior. These traits can create a toxic environment, especially in personal relationships and workplaces.
Speaking of personal relationships, how does someone identify if they are in a relationship with a narcissistic individual?
That's key. Often people find themselves questioning their reality. If someone feels frequently invalidated, like their feelings don't matter, or if they're constantly walking on eggshells, these can be red flags. It's also common to feel depleted or confused after interactions with a narcissistic person, as they often twist conversations or manipulate situations to their advantage.
Those feelings sound exhausting. So is this something prevalent in today's society? Why do you think there's so much discourse surrounding narcissism right now?
Narcissism has indeed become a hot topic, in part because it feels like we're living in a culture that sometimes rewards these behaviors. With social media, for instance, many people are sharing a curated version of their lives that often highlights their successes and rarely their struggles. This can foster an environment where narcissistic traits are not just visible, but often celebrated.
That's an intriguing angle. It's almost like a societal feedback loop, isn't it? As narcissism can seem attractive, it gets reinforced in our culture. And what about the impacts of these patterns on our mental health?
Exactly. The impact can be quite severe. People who are consistently exposed to narcissistic behaviors may experience heightened anxiety, depression, and even a diminished sense of self-worth. They may struggle to form genuine connections with others, leading them to feel isolated and unsupported. It's a cycle that's difficult to break without intervention and understanding.
This is a great point. Understanding these dynamics must be empowering, allowing individuals to acknowledge their experiences. Could you share how people might begin to navigate these complex relationships?
Certainly. The first step is education. By learning about narcissism and recognizing the signs, people can detach some of the blame they may feel for their situation. Establishing boundaries is also critical. It's important to communicate your needs clearly and protect your mental space. And if it's too overwhelming, seeking professional help can be immensely beneficial.
Establishing boundaries and getting support are excellent strategies. I suppose it's a way of reclaiming one's power in those situations. Are there any specific techniques or practices you recommend for those dealing with narcissistic individuals?
Absolutely. One effective technique is practicing assertive communication, being direct and clear without being confrontational. It can also be helpful to remind oneself of their own values and worth. Affirmations can do wonders for self-esteem. Journaling can help too. allowing individuals to process their feelings and view situations more clearly.
Those sound like essential tools. As we wrap up our conversation, let's reflect on the key insights we've discussed. Narcissism is a pattern of behaviors that can deeply affect both the person exhibiting these traits and those around them.
Exactly, Alex. Understanding the distinction between narcissistic traits and narcissistic personality disorder is crucial. It's important to remember that many individuals with narcissistic traits may not have the disorder, and yet the impact of these behaviors can still be significant.
And recognizing these patterns in ourselves and others provides a pathway to healthier relationships. Education and strong boundaries give us the tools to navigate these dynamics more effectively. It's quite empowering to take control back in these situations.
Absolutely. Thank you so much for having me, Alex. I hope this conversation helps listeners understand narcissism better and encourages them to cultivate positive and healthy relationships.
Thank you for being here and sharing your expertise. To our listeners, remember, knowledge is power, and understanding these dynamics is the first step towards healthier relationships. Until next time, take care.